Good afternoon. Buenas tardes. My name is Javier Becerra. I have the privilege of being the Attorney General for the state of California. Some of you may remember me as the congressman from the LA area up until a few months ago. In fact, when I was a member of Congress, the district I represented here in downtown used to have some of the hardest working people, but people who could not afford to get health insurance. It wasn't that long ago that most of the people who work very hard could barely afford health care, and too many of them never had it. And so to be where we are today is very important, because whereas a third of all the people, of the 700,000 people I represented in that part of LA, had no health insurance, well, by the time the Affordable Care Act came, and after a few years, we had been able to reduce the number of people who were uninsured just in that 34th Congressional District by almost half. By almost half. In California, some 5 million people have received health care as a result of the Affordable Care Act. We have seen our uninsured rate in the state of California come down from something around 17% to now barely 7% of our total population. We've never seen so many people in California insured and able to go to visit a doctor or a hospital. How many of us here take for granted that if our child gets sick, we can go to the doctor or go to the hospital? Yet, how many people here today could not have said that before the Affordable Care Act, that they were too afraid that they might go bankrupt if they did go visit a doctor or a hospital? What seems imaginable just a few years ago, having access to a doctor or a hospital, is now reality. Also a reality is the fact that kids can stay on their family's health care plan until they reach the age of 26. That wasn't the case before. Your kids used to get bumped off of their coverage when they got to their 20s. Some by the time they turned 18. Today, preventative services like cancer screening and birth control are covered with no out-of-pocket costs. And you can't be asked to pay more or be denied care simply because you're a woman. Because before the Affordable Care Act, if you try to buy the same plan as a man, you were probably going to have to pay more for it simply because you were a woman, because you bore children. I don't know about you, but I'm not interested in going back to the days when health care was only for the healthy or the wealthy. So that's why we're here today. We're here to announce that the state of California, joined by 15 other jurisdictions, 14 states and the District of Columbia, have today filed to intervene in a lawsuit to protect the health care that millions of people in the United States of America and more than 5 million people in the state of California have gotten through the Affordable Care Act. We want to make sure that you can take your daughter or your son to go visit a doctor or go see emergency health care services at a hospital if you need it, and not worry that you'll go bankrupt because you did that. We're not willing to let Washington, D.C. and the administration that's there sabotage the health care that you have earned because you worked hard for it and that your kids now rely on. And we're going to do everything we can to make sure that regardless of what the administration in Washington, D.C. does, regardless of what members in Congress try to do to the Affordable Care Act, we're going to stand up for your health care, because we understand what it means to be able to have the peace of mind, the security of knowing that you won't have to give up the rent check for the month or not go to the grocery store for a couple of weeks simply because you had to take your son or your daughter to go see a doctor. But this is the problem. What we are doing today legally through our suit to intervene in a case that exists right now is simply to get into a case. There is a case right now called House versus Price. It's the House of Representatives, more specifically the Republicans in the House of Representatives, who sued the Obama administration to try to undo some of those cost-sharing subsidies that make it possible for the people in this room to be able to afford their health care by reducing the cost of the co-insurance or the co-payments or the deductibles that people pay for their insurance. That lawsuit would remove those subsidies, those cost-sharing subsidies that make it more affordable for you to have your insurance. If the Republicans were to succeed, or if the new administration were to abandon its efforts to defend the Affordable Care Act, then you would be paying more for your health insurance. You would have to be asking, can I afford to still take my daughter to the doctor? Because I know I need to pay the rent. And so that's why we're here today, is to make sure that we are protecting what you have earned. 6 million people in the United States of America today rely on those cost-sharing subsidies to be able to buy their insurance. And in California, half of the people that have gotten their insurance through the Affordable Care Act rely on those cost-sharing subsidies to be able to afford to keep their insurance. We're not looking for anyone to take that away from you. And if President Trump decides he wants to abandon the defense of the Affordable Care Act, we're ready to pick up his fumble and do it for him, because we believe that people have a right to good health care for themselves and for their kids. We are ready to defend those families. And so that's why we're here. We're here to tell California families and families throughout the country that the 14 other attorneys general who have joined me, along with the Attorney General from the District of Columbia, we will stand up for your rights. We want you to know that if your child gets sick, if you find out that you have cancer, if you need that medicine, that you should be able to go get it. We want you to know that you should be able to go to work knowing that you have the health security that you need for your family. And what we want you to know most of all, and what I want you to know most of all as the Attorney General for the state of California, is we've got your back, because you have our back. You work really hard for us. It's time for us to have your back. And that's why we have entered this lawsuit, to protect your interests, your rights, and your family to be able to be healthy and grow and prosper. With that, let me now introduce to you someone who has been a great friend, but more importantly, who has been one of the leaders on healthcare for quite a bit of time, who was willing to let us use this facility here today, because it's one of the best facilities you can find that offers healthcare for a lot of people who are hardworking but modest income. Let me introduce now the CEO of St. John's Well Child and Family Center, Jim Manja.
Thank you all for being here. Thanks to all the community organizations, all the St. John's patients and staff. Really appreciate you being here with us today. Let me start with this. Healthcare is a fundamental human right. Here at St. John's, we made a decision a long time ago to immerse our organization, to saturate every activity and program, to infuse every service and each action in that fundamental belief that health is a human right. This is the principle that gave rise to the Affordable Care Act. President Obama said it over and over again: health is a right for all, not a privilege for the wealthiest few. We must be expanding health coverage to all, reducing unnecessary costs, and increasing access to health. And we've had our successes. The Affordable Care Act is a tremendous success. Today, California's uninsured rate is below 7% of the population, the lowest in history. Now, we still have more work to do. And that's why we're so honored to stand with Attorney General Xavier Becerra today, defending that human right to health. We're standing because we are living in strange times. We have a president and a Congress who don't believe that health is a human right. They prefer to spend trillions on tax cuts for the richest Americans while cutting health care for the middle class, for the elderly, for the children, and the poor. They want to cut subsidies to Americans who earn between $11,000 and $30,000 a year so that they can no longer afford to buy their own health insurance. Let me tell you what this means for St. John's and for our patients. 4,000 families, close to 4,000 families, will lose their health insurance if these subsidies go away. So we must do what every man and woman of conscience should do. We must resist. So as a healthcare leader and the CEO of St. John's, and as a resident of this great state, and on a personal level, I can't tell you how honored I am to stand here today, arm in arm, with our new Attorney General. From his first day in public office, he has been in the trenches fighting for the poor, the disadvantaged, and the vulnerable. As a state legislator, a congressman, a congressional leader, and now as our Attorney General. Javier Becerra has never shied from a fight, never wavered in his commitment to serving the interests of all Californians, not just a privileged few. Today he leads attorneys general from across America in intervening in a federal lawsuit to save the Affordable Care Act and to affirm for all to see and hear that health care is a fundamental human right. Thank you so much for being here today.
Let me now introduce to you some people who can talk to you not as the leaders in healthcare, not as a fortunate and privileged leader in elected office, but someone who has lived what it means to have health insurance now for their family. I'm going to introduce to you two individuals. I'd like to begin with Horacio Chavez, who will tell us about his experience securing health care for himself. Horacio.
Hello, my name is Horacio Chavez. I'm 35 years old, and I'm a resident of the city of Los Angeles. I currently receive my health care through Covered California, and I'm a patient here at St. John Wells Child and Family Center. I currently work at a children's center, and it's really important for me to have good health for myself and for the children that I work with. I see hundreds of children every day, and I'm constantly exposed to many illnesses. That's why I think it's crucial for people like me to have access to affordable health care and to great physicians. Before the Affordable Care Act came into effect, I spent multiple years without any source of affordable insurance. And ever since it came into law, I've been covered at a reasonable rate. The Republicans want to repeal Obamacare, and it's going to impact people like me significantly. Without any federal subsidies, hardworking people like me would not be able to afford health care. That's why I'm here with Javier Becerra in support of his effort to protect my access to affordable health care in New Covered, California. Okay. Hola, buenas tardes. Me llamo Horacio Chávez, tengo 35 años, soy residente de la ciudad de Los Ángeles. Tengo mi seguranza de parte de Covered California y soy paciente aquí en la clínica de St. John Wells Child and Family Centers. Yo trabajo en un centro de niños y es bien importante mantener buena salud, no solamente para mí, pero para los niños que yo trabajo con. Cada día veo cientos de niños y siempre estoy expuesto a diferentes enfermedades. Por eso es importante tener acceso a seguridad médica y a doctores. Antes de que pasó la ley del Affordable Care Act, me pasé varios años sin seguridad, pero desde que se convirtió en ley, he tenido seguridad que yo puedo pagar. Los republicanos quieren remover el Affordable Care Act y eso va a impactar a gente trabajadora como yo y a mucha gente de mi comunidad. Y por eso yo pienso que es muy importante tratar de proteger eso. Por eso estoy aquí apoyando a Javier Becerra y su esfuerzo en proteger seguridad médica para millones de californianos y gente a través de la nación. Muchas gracias.
I gotta make sure I take some Spanish lessons from Horacio. Man, he was good. Just like that, on the fly, right? Very good. Let me now introduce someone else who can tell you about her experience trying to navigate a world and finally having access to health care. Sandra Weathersby Sanders is someone who can tell us about what the Affordable Care Act has meant for her. Sandra.
Good afternoon. I'm Sandra Weathersby. In 2008, we might recall the crisis that we all went through. During that time, I lost my job due to a layoff. The only option I had at that time for health insurance was COBRA. As a single parent of 2 children, in no way could I afford COBRA. As time went by, I found out about Medicaid. And Medicaid made a big difference in my life. It made it possible for me to ensure that my daughters received the health care that they needed. And to this day, they're both in very good health and condition. And I'm grateful for that. Here recently, years I should say, I purchased my health care through Cover California. I'm truly grateful that the greater part of this cost is federally subsidized. As long as this is in place, the cost of my health care isn't my immediate concern when I'm at work. While at work, I can be productive, I can be focused on my job. My thoughts will not be solely on, will I be able to earn enough to pay for my premiums and my co-pays? That should not be my concern. I'm sure my supervisors and my crew chief and everyone I'm working with, they would appreciate me being more focused on my job. Additionally, I am more likely to attend my medical visits and also do what I can for preventative care. And so that is why I am so grateful to everyone who is working towards defending those of us who rely on this health care, Affordable Care Act, and ensuring that we all receive the health care that we need. I'd like to thank Attorney General Becerra and all others who are pushing and fighting for us. Thank you.
Sandra, thank you. And it's really great when you can have someone who could tell you the experience of having access for her family to health care, both through the Medicaid side of the Affordable Care Act, but also once she got back to work, was able to go out there and get a plan through the Covered California Exchange. And that's the beauty of the Affordable Care Act. It was meant to provide everyone with a way to gain access. And that's what happens when you succeed in that. You have people like Sandra who get to concentrate on doing her work really well and knowing that her kids can visit that doctor. That's so important. Someone who has fought for years to make sure that people who work really hard for our state and for our country have that opportunity to be able to concentrate on their work is a woman who has been just a bulldog when it comes to fighting for health care for all. She also is someone who helps coordinate for Jim Manja and all the other community clinics that do such tremendous work, the effort to make sure that the clinics throughout our state and throughout the nation have a chance to move forward. Louise McCarthy is the president and the CEO of Community Clinics of LA County. She has been one of the leaders on healthcare for so long. But what's really important is for you to know that you don't have to have access to a physician in a private office or through a hospital to get quality care. We have tremendous community clinics like the one we're in right now at St. John's. And that's because of the work that's done by Jim Manja and all the people with all the clinics. And that is why Louise is so important, because she makes sure that they're doing nothing but top-notch work in providing health care for all. And I want her to step forward as one of the big defenders of health care for all Americans. Please help welcome Louise McCarthy.
Thank you. And I welcome the description as a bulldog, because these are times when we need a lot of guard dogs to protect human rights and access to health and health care and things that are just in our communities. Across LA County, from Antelope Valley down to Long Beach, from Venice all the way into the San Gabriel Valley, community clinics and community health centers, these are nonprofit providers, operate over 350 full-time sites serving the communities that help them shape the care that they delivered. These are community-driven nonprofits responding to needs across the county. 350 full-time sites and 1.5 million patients seen in 2015. 1.5 million patients. The majority of them on Medi-Cal, 57%. For the first time in clinic history, they saw a majority of patients who were insured instead of uninsured. This is historic. This is historic, and we can't go back. Across LA County, beyond the clinics, the expansions from the Affordable Care Act touched 1.5 million Angelenos, and over a quarter of them got access to coverage through Covered California. So as we think about the story of the intersection between Medi-Cal and Covered California, Medi-Cal is a program, Medicaid is a program that helps people at their time of need get access to critical healthcare services. It is about helping them cover the costs of care so that they can get up and out of poverty. Removing the exchange subsidies for the folks that get off of Medi-Cal is just inhumane. It sends them back away from the income upward mobility that they were seeking. It sends them back to the public programs that will need to support them for care. And we need to absolutely oppose any sabotage to the system of supports, such as the subsidies for Covered California. So I thank the Attorney General, I thank St. John's, and all of the advocates that are here today to speak out and to take action against the sabotage to Covered California and the exchanges across the nation, against the sabotage to the Affordable Care Act, and all of the ways in which we have expanded and improved care for our communities. Thank you very much.
Luis, thank you, and we'll take questions in a moment from any of the press who are here. I just want to repeat, I think it's important, the word sabotage. California is proof that the Affordable Care Act works. You just have to be earnest about an effort to make it work. If you've got state leaders, governors, and legislators who undermine it, who sabotage it, of course it won't work. But if you have state leaders who believe it's important to get men and women, like those who are sitting here and standing here, with coverage so they can feel comfortable going to work, it'll work. And talk to the 5 million people in California who have coverage. It works. You just got to believe it and try to earnestly make it work. No more sabotage. That's why we're stepping in and intervening to make sure it will work. So I want to thank everyone who's joined us, certainly to our speakers, to the press who has attended. We want to thank them for helping convey the information to the rest of the country and to the state, what we're doing. But can I just really have you thank the people who spoke today, because they've been the champions for healthcare for all of us. Thank you all very much.